So in the first sense, I guess there needs to be some sense of inspiration, or you need to have your own orientation to what you're doing and why you're doing it. I guess it can't just be about controlling the classroom, and in fact, if I find when people focus on this issue of control, that tends to lead to more disruption, because the kids sense that, and it actually creates a kind of a challenge to the young person. If you're a person that seems to be very determined to have control, well, that's a big red light to them straight up, particularly if they've got problems. For a lot of kids, it won't be a problem. They'll be quite happy to do the work, but you could probably guarantee that if you've got a young person with authoritarian issues or whatever, they're going to see that as a challenge, or because it's just going to feel very uncomfortable to them if you have a fairly strong disposition to control. Kids are very sensitive to this issue of care versus control. And so what we have to do without crossing our professional boundaries is actually demonstrate some degree of care. And if you think back to your own experiences in school, the teachers that were probably the most popular teachers were teachers that seemed to care. In fact, they make movies about teachers that care. Goodbye, Mr. Chips. You know, these are people who can both present the information, can help students to learn and be motivated by that, but also demonstrate that they're interested in that young person. And what kids tend to do when they get angry is actually say to you, "You don't care about me, you just want me to do what you want me to do." So again, if you're not genuinely interested in trying to support, you're not going to be able to fake it, because they'll pick that up. Adolescence is the perfect, we're in a very funny society these days because everything seems to be getting reversed. I know that when I was a young person, we wanted to be like the adults around us. So I grew up, I played in sporting teams with men, and so I tended to sort of, that's what being a man was. These days we have, middle-aged men and older trying to be like young people. And in fact, the youth culture now is kind of dominant. And so where do young people have to go? They have to get more extreme sometimes to express themselves. But as a biological, psychosocial phase of development, there's an enormous amount of changes going on. That makes life pretty tough as it is, let alone add in family problems or mental health problems or some other psychosocial stress, which is going to make them more reactive to start with. So that's what you're dealing with. It is the second most complex phase of development in the human life cycle. The first being the first 3 years of life. But that only lasts 3 years, and that's mainly biological, whereas this is actually biopsychosocial and cultural. Think of kids you may have in your class that come from different countries, or have just moved interstate, or have families that are just going through divorce and things like that, or have lost a close relative and things like that. Let alone an actual depression or anxiety disorder. Whenever you've got private concerns, they're private concerns because they're private. No one likes to wear their dirty laundry in public. In fact, if they do, then that's a worry. But it's this sense of kids don't want to be exposed. They want to feel like they're a part of the group. They want to feel like they're a good part of the group and stand out in a good way. They don't want to stand out in a bad way. So they don't want to look different in a negative way. Hence, that need for privacy. And also there's just the uncertainty of development. Kids themselves actually don't know where they're going and what they're going to become. They might have hopes and dreams about where they want to be and who they want to be, but none of that's guaranteed. And it all feels very uncertain. It all feels very fragile, with only the slightest thing, needing to take place to take away those kind of hopes and dreams for the future. So they can be very reactive when they feel like their sense of self or their future is being threatened, that something bad's going to happen to it and it's going to leave them marked for life. They may not necessarily know exactly what they want to be or how they want to be. They certainly know what they don't want to be. And so often they're protecting against that kind of damage or contamination from some sort of outside influence. Or exposure, having their weaknesses or their faults or failings exposed in front of everybody else. And it's not hard, if I was a teacher and I picked out one of you to talk about your personal problems in front of everyone else without warning, you'd be rightly angry. So why would a young person be any different if it's done to them in the classroom? How to start a riot. So you probably all know how to do this, or you've had various experiences of yourself doing it without meaning to. I'm just trying to help. I was only asking them about, how things are with mum and dad. So the first thing is, ask them very loudly in front of everyone else if you have a problem. Kim, what's going on at home today? Didn't you get enough breakfast? It's that sort of stuff that is actually going to, by making them a focus of the rest of the classroom, it's going to make them very reactive. They'll either pick up a chair or run out of the room or swear or just not come back if they're quieter and withdrawing. Again, they're very private concerns. So we all have that respect for privacy. Respecting someone is respecting their right to privacy. It's exactly the same as what you would want as for your own self. So it's not rocket science to think this is what you need to give to others. The other one too, the last one there, is more about sort of, that whole expectation. Well, don't you care? You've got to respect the rights of others. That's just a red rag to a bull. They're just going to go, well, you obviously don't think I care. You obviously don't think I respect anybody. You don't care, respect me. So they'll go, sure, that's what you think. Here it is. Cop some more, It's that and again, it's this context that young people actually don't have the maturity of an ego, a developed ego that's to develop these things around problem solving, stress management, coping. They are the way they are because they're in that process of trying to work out how to do these things, how to become an adult. And unfortunately, there's plenty of adults that don't know how to do it either, Just watch Parliament time. So again, this thing of exposing young people or getting them to be the focus of the rest of the class, these are the things that are going to create conflict and reaction in terms of doing it. And it's great advice, isn't it? Just because you have depression doesn't mean you need to be so negative all the time. Cheer up. You're bringing us all down. Again, it's sort of making them feel guilty and ashamed for what's going on, or that they're not trying hard enough or making an effort. Anything that devalues that kind of sense of their worth as an individual. Because a lot of young people already have that fear that, particularly when their life is not going well, that in some degree they're empty or worthless or bad in some way. And that, the worst things that we can do as adults when we're trying to help them is kind of reinforce that notion that, yes, you are worthless. Yes, there's not much good, you're not good for anything. You haven't got any skills. And going back slightly, a problem like saying you'd be a lot less anxious if you did your homework sometime isn't understanding the problem. Maybe it's the anxiety that stops them getting to do the homework. So you have to stop looking at the behaviour as some kind of endpoint and see it more as a symptom, that there's something else underneath. So when you react to the behaviour alone, even though there is a need sometimes to try and contain that behaviour, when you only act, react and judge on the behaviour, you're missing what's driving the behaviour. And so if there's a problem, if there's something behind that behaviour that's driving it, that's what you need to get to, that's what you need to understand. And hopefully when that goes away, the behaviour goes away. These are, again, very simple things. To see the behaviour as a symptom, not a reflection of the person, respect their right to privacy and respect, even if they're not reciprocating it back. Again, that's our job as professionals, as teachers, to actually have to wear some of this sometimes, because, I don't know, in my career I also found out that when kids are really angry with you, they kind of swear and call you names and make fun of you. And then when they really like you, they swear at you and call you names and make fun of you. So, it's just learning that it doesn't matter whether it's in a positive way or a negative way. That's just how they cope. And you can take one person out of the way and put another there, and they'll do the same thing. It's not personal. And again, that's what we need to do as professionals, not take it personally. Because then you're just buying into that last one, which makes it more reactive. If you do take it personally, that you're going to end up doing something. Right, well, I've had enough of you. Get out of my class and go and see the principal, and you're going to be off school for 3 days. Fine, that's what you want. And out they go, because you've given them exactly what they want. You've been angry, you've rejected them, and you're being punitive. If you're talking to a young person that already has a lot of that in their life, all you've done is reconfirm their theory or their evidence that all adults are punitive, uncaring and rejecting. It's about taking a step back from that and just going, oh, right. I remember one day coming into work and walking down the hallway, minding my own business, and one young person who obviously wanted to get to know me says, oh, how you going, you bald-headed, or something like that, I can't remember exactly. And I just turned around and said, oh, look, sorry, I haven't met, I don't know who you are. I said, it's going to be really hard for us to get along if every time we meet you just call me a bald-headed. How, like, I might get angry about that. And he's like, ooh, like, I'm not sure, do you want to get on or do you want to spend all our time arguing? And by just breaking it down into a kind of a normal reaction, a normal social interaction, he's like, oh, well, he can take a backward step and look at solving the problem. And that's where we have to be quick on our feet. I think if I was doing a lot more training in education, I'd actually create those little workshops where you get one person to be the angry kid and spark the other two, and you have to come up with the words and phrases and the reaction, courage under fire, so to speak. Because they don't make it easy for you, and the more you get under pressure, the more likely you're going to sort of get caught up and more likely you're going to move towards an angry response or a punitive response, trying to take control again. I mean, as adults, you don't need to take control immediately because you have that luxury that you can come back the next day. If the kid's not going to do what you're asking at that time, it gets resolved later. If their behaviour does escalate to the point where it's very severe, you're fairly confident they will be put out of school for 3 or 4 days or a long suspension or a short suspension. If you can't win on the spot, don't get caught up in thinking you have to control right there, right then. And I think at Rivendell you've had lots of experiences already where you move towards lockdown or, take the class somewhere else, leave somewhere where they are. It's harder to do in big schools, but, the more pressure you put on yourself to be able to control there and then, the more you're kind of backing yourself into a corner. And so you're not, that's only going to increase your stress. The more stressed you are, the more likely you react out of that panic rather than able to respond to what's happening around you. One of the best things I ever learned was this one step down approach. So it's literally like standing on the step below, so you're looking up rather than looking down. Again, kids on a very concrete level hate being looked down to. So just that reversal of where you go, excuse me, I'm not sure, but you seem to have some trouble with that work. Do you mind if I look at it and try and give you a hand? Rather than, you look like you really can't do that. I think you need me to come in there and do it for you or something like that. That puts them down. So you're giving them the opportunity to ask or say, no, it's not the work. The work's really easy. I'm just caught up with what happened at home. I can't think straight this morning. So it creates an opportunity for an opening in that sense. Again, with offering help, instead of going to the thing of saying, well, it looks like, Mum and Dad have been arguing before you got to school today. I think we should catch up after class and I'll give you some strategies to cope with that. So again, it's like, it's all that embarrassment and humiliation by having their problems aired in public again. So by giving them the opening, the opportunity to say, look, I'm available to help if you want it. Again, they can say yes or no, but the important thing is they know it's been offered and they know it's been offered respectfully. And they may not take it the first time or the second time, but there's a much better chance that they will eventually take it on board. So I was just on a more mental health basis, I was talking to one of my staff and she'd engaged with a young person that had turned up for self-harm and suicidality, and she said, oh look, I've been seeing her for, at the beginning, she said, I've been seeing her for 2 weeks. She just comes in and she sits there and doesn't say a word, and sometimes I talk or try and say things and she goes yes or no and really doesn't engage. I think I may as well discharge her and, send her back. I said, no, I said, the fact that she's actually coming to see you says a lot. That's the important thing. She's coming in every week. She's making the time and the effort to get here. So in some way it's important to her. Just keep making the appointments. So sure enough, 2 weeks ago, Deanna comes back and says, it's amazing. I just asked her one thing and all of a sudden, all of this information just came out. After 3 months, she just suddenly started to talk about all the things that were going on in her life and in her mind. Because it takes young people quite a while before they can trust you. before they actually know whether you're, as we talk about, you're able to contain them or you're safe with their private concerns and problems. They need to know you're not going to share them with everybody. They need to know you're going to try and understand. And conversely, they're also worried that maybe if I talk to you about too much of my shit, that's only going to make you worse. You'll probably end up getting sick and leaving work if I tell you all the awful things that are going on in my life. So young people are often quite worried about the effect of talking to the adult, what that might do to the adult as well. So there are all these concerns that sort of create barriers to a young person wanting to share their information with you. And the only way around it is just time and patience until they get to have that degree of trust that you're going to be a safe person and a strong enough person to contain what they have. And as teachers, you actually don't need to do all that. You just need to, unfortunately, they may see you as the person they want to share it all with. So sometimes part of that negotiation is to say, look, I can't help you with these things. What I can do is help you to find someone that would be better placed or better, has more experience in helping you with these concerns. Because unfortunately, young people work on the way they feel and they go, well, I like you, so I'll tell you, Whereas it's that maybe they don't understand that, well, you like me, that's because I can do these things. There are other people that do the same things that you can talk to and trust and share with as well. And I can help you find them. So as you can see, it's when you start to worry about a young person, as to what it may actually be, it's very hard to tell. And most young people actually don't get help. They keep it to themselves and they hold it in, and somehow they do. I'm always worried about the high achievers, actually, that go through. Particularly as a side issue, we have the children of parents with mental illness. These are kids that grow up with a parent with an active mental illness. Quite often they have enormously stressful lives. And yet so many of them, as the research points out, they're really high achievers. And they get through high school getting perfect marks, never causing a problem. They could even be school prefects. What we know from the research is they fall apart in their mid-early 30s. That's when their coping starts to fail them, But we miss them in school because they're perfect students. They don't cause any problems and they get good marks and they make me look like a good teacher. So that's, what's to worry about? That's all the important things. But they account for a lot of that 50 to 80%. And just young people often don't want to share their problems because they're worried if they start to let any of it out, it may take them over. It may become, I have to hold on to it because that way I can hold myself in place. But if I do start to talk about it, it may take me over, So they often feel like they're in this battle to try and maintain a sense of self and try to move forward into the future. Again, I had, when I was working at Rivendell, we had a young boy that had a very severe schizophrenia and psychosis. And he used to sit in our classes on psychoeducation, and like many young people with an active psychosis, he'd respond to things, hallucinations. He'd just start looking at stuff, or he'd just smile, and you go, "What are you smiling at?" And he'd go, "I'm not smiling." And then it wasn't until, again, about 4 or 5 months later, and in this case, the medication that we put him on worked really well. And got rid of all that kind of the symptoms, the voices and the other hallucinations that he was responding to. And at that point he was able to say, because I remember taking him for a blood test and we were walking back, so I said, what do you think is the problem? And he said, I think I've got a schizophrenia problem. But up until that point, until the symptoms had gone away, he never had a problem. It wasn't until the symptoms were contained that he could actually talk about what was wrong. And then he could actually start to make more of an effort for himself to look after his own well-being in that sense. But while everything was out of control, he had no problem. Well, he wouldn't acknowledge a problem. Again, when you are worried about a young person, it's not good to try and get them to tell you. It doesn't make you a better teacher or a better human being, and it doesn't actually help them solve their problems if you find a way to get them to just talk about it. Because it actually makes them worse. when, certainly again using examples from Rivendell with a number of young people whereby they would disclose sexual abuse. I think the first 5 all ended up in a psych ward after disclosing their sexual abuse because they go through a psychotic kind of breakdown. It might last only a week, it might last 6 months, but the stress of that disclosure would cause a complete kind of psychological disruption for, period of time. So yeah, there is a reason why most young people don't want to immediately share. I guess that's a lack of confidence in the adults around them and their need to make sure if they're going to talk with you and share their personal information that it's going to be safe. And the second part of that is also that in telling you that it won't affect you badly either. So again, I used to remember from working here at Rivendell, if a teacher was off or a nurse was off, quite often if they were attached, if the young person in that classroom was very attached to them, they'd often ask someone, oh, are they okay? Is there something wrong with them? And they would actually have that fear that it was them creating that illness in the other person. So they're very sensitive to what might happen if they talk. And I guess, if they're coming from environments whereby there's not a lot to be hopeful about, their expectation is it's going to end badly if they do. And unfortunately, with more severe things like, physical or sexual assault, there is a whole sequence of events that takes place that's incredibly threatening and destabilising to them. It can mean the breakup of families, it can mean removal and things like that. So to them, they can't see the big picture, they just see the immediacy of what's going to go wrong and the stress that will cause. And again, it's just important, even if you can see that they have a problem and they're really close, because what happens is young people go from, there's nothing wrong, I'm okay, leave me alone, to starting to hint at things, and depending on their relationship with you, usually they normally start to say things like, well, look, if you really knew me, you wouldn't like me. Because they're hinting at there's something bad or awful in their life that if it comes out, you're not going to like them for it, and so they take on that responsibility. Or they're just psychologically not ready. And again, if we push them too fast or too soon into trying to talk about what's going on in their life, it'll overwhelm them. So again, my experience was, particularly with things around sexual assault in particular, when a young woman would disclose, they would quite often have a psychotic episode after that. And that could mean up to a week or several months in hospital in trying to, because all these paranoid fears come out of their mind when they do it, that the perpetrator's going to find them, that they're going to hurt them, that all the things they were told will come true. And they just can't cope with that, So again, that's part of the next talk. Even though that's a kind of a transient mental illness, it's not a mental illness as such, it's a trauma response. And a lot of these things that we see in the young people are a result of trauma in their lives. And lastly, if you've got a reputation with all your kids or students as being a very unpopular and uncaring and teacher, you can't suddenly expect to go, tell me about what's happening in your life, because they're not going to believe you. So your best asset in all of this is just to be consistently a positive, friendly, open person. Someone that already has that reputation of being a safe teacher, a nice person, a good person. That's really what they're interested in and looking for, in that sense. And you can't manufacture that overnight. That just depends on knowing who you are, or them getting to know that's who you are. Because they have their doubts about it at times, but you're in the position whereby you get to spend time with the students over time, so they get to see you over time. And kids are very wise judges, good judges of character, because they look for the consistency between what you say and what you do. And they're really good at picking up all those inconsistencies about you said this but you do this, And all you have to do is be consistent with what you say and what you do in the nicest possible way. And that makes you a person then that if they do have some concerns, they might have that willingness to talk to you. So building rapport. Again, that just comes through your own personality and stuff like that. But you don't have to have the world's best personality. You just have to have a good communication technique. You know, of not cutting them off, not talking over them, not prejudging what they're saying, but just being able to ask the right question back or make the right statement in return. And again, I find making kind of, statements that are gentle, that kind of acknowledge something without actually saying what it is much better. So I remember early on I'd say things to kids like, oh, well, I think your problem is, you've got this, that and the other. And it kind of worked for a little while until one day one kid looked at me and just said, what are you, a mind reader? I went, no. Well, what makes you think you know what's going on? And he was right. It's not that I was wrong, but I was wrong in the sense that it was intrusive. I was telling him he doesn't need that. And again, it was making him more defensive. Just because I could name his problem didn't go, oh, thanks, you know what's wrong with me, I'll talk to you. It was like, get out of my head. Because they already have a fear that you can see inside their head. They already, especially if you've got a student coming to an education centre like Rivendell, which is a special ed place, special schools program, they already have a fear that everybody here can see inside their head, So you don't want to reinforce that, unless you're particularly cruel. I found it better to just go back, to take back that one step remove situation again, which is to say something like, things don't seem to be working out the way you'd like them to. And sometimes you get much less resistance to that. They might say, oh yeah, no, what do you think? Yeah, well, I'm just wondering why that is. Is there something we might be able to do about it? So it still creates an opening to go to the next phase. You don't get blocked as much, or the blocks or the obstacles that arise are still easier to negotiate. Have you had a chance to talk to somebody that's bothering you? No, why would I talk to anybody? There's no good that they can do. Yeah, that might be true, but we've got some good counsellors here. Maybe just take the time and see what they have to say. So you create these possibilities. You don't create statements about things. You're just creating an opening that they might be able to move towards, in the hope and in the confidence that your colleagues will pick that up and give them, a nice professional responsive ear that does create that opening, that they do talk and they do express themselves. Is there someone you might feel like talking to or with? Well, you're all right. I've started with you. Why can't I talk to you? Well, I can talk to you about some things. I just can't talk to you about everything. And there might be things that you need to talk to someone else and spend more time with. Unfortunately, Anne keeps wanting me to teach classes all the time. Pays me to be a teacher, not a counsellor. And at that point, as just pointed out, when you get that opening and they go, look, I do need to talk to someone, then you can say, right, well, let's go and see so-and-so and take it from there. And then you've done your job as a classroom teacher with a young person that may or may not have a problem. Sounds very easy, doesn't it? That's the first presentation.